Hello, everyone. Welcome to this live webinar. We're waiting a little bit, yes, for all the participants to enter the room. And then we'll be starting in a few seconds. Now, there's quite a number of people today coming from a lot of different countries. I'm very glad to see some old friends with whom I had the chance to work in the past. So hello to all these guys coming from different countries where I had the chance to operate, from Russia, from Ukraine, from the Baltic states, from Argentina. I've seen some people from the United States as well. So welcome everyone. We'll be waiting a little bit more before we start the webinar. I hope you guys are all doing well in all the countries where you operate. In France, there's going to be a big announcement today at 5 o'clock, where they're going to kind of open the lockdown step by step. So I'm based in Bordeaux, where the company is based, and today I'm doing the webinar from my place in Bordeaux. Well, hello everyone. Thanks for joining this webinar, this live webinar. We'll be starting now. It's almost time, so perfect. We are perfectly on time. So my name is Julien Delpech. I am the founder of ᴘᴏsᴛ-ᴄᴏ, and today I'm going to walk you through a short presentation. Not so short. It's going to be around 30 to 35 minutes. And at the end of the presentation, I will take all the questions that you want to ask me. So if you are familiar with Zoom, which is the video conference system that we are using, you will see that there is a small icon on your screen for question and answers. So you have the liberty to ask any question that you want, and I'll be glad at the end of the call to take the questions and to try to answer as much as possible. So it's very easy. There is like a question and answer icon. You just click on it, and then you can ask your question, and I will answer the question at the end of the talk today. So let's start. Topic of the day is a very hot topic. It's how to keep in touch with healthcare professionals in post-COVID time. So just a few things to start. Sorry. Just for me to have no conflict of interest except with ᴘᴏsᴛ, which is the company that I created, but all the different companies that I'm going to name today, I don't own shares with them. Just a little bit of background about myself. I've been working the past 20 years in the pharmaceutical and medical device environment. I had the chance to start my career with a French company called ᴘᴏsᴛ. I started in the former USSR. I worked in Russia, Ukraine, and all the other countries of the ex-USSR. And then I moved to Latin America to start the operations of ᴘᴏsᴛ in Latin America, and eventually moved to Allergan and other pharmaceutical companies famous for Botox. I worked there a few years and then moved to the medical device environment before I started with Cytori. Amongst the little facts of glory that I have, I was extremely proud to be part of the team who launched Smecta in Russia a long time ago. So just about ᴘᴏsᴛ, so ᴘᴏsᴛ is a French startup. We're based in Bordeaux. We are around 30 people in the company. And the company has raised recently 7 million euros with a French investment bank and investment funds. Today's agenda, I'll talk about this new era we are entering, which is called the post-COVIDian era. I'll also talk about the main topic, of course, which is how to keep in touch with healthcare professionals while they are not very much available. last but not least, I will use some business cases, very practical business cases, and I will detail them. And at the end, I will do something almost impossible, but for some of you that know me, I like the impossible. So I'll try to summarize, to wrap up everything in one single motto. Well, I hope you're okay with this agenda. So let's enter the core of the topic. Yeah, I mentioned that we are entering a new era that I call the post-COVIDian era. The main difference today is that in the pre-COVIDian era, a lot of the activities that we used to do in the medical environment were on-site events, yeah, the in-situ events, the visits to the physicians, all the conferences, the roundtable. Most of the activities were on-site activities, and we could see, we could contemplate the beginning of all the online activities. Thanks or because of the COVID, what happened is that these constraints created like a big shift. And now what we're seeing is that we're seeing less and less on-site activities and more online activities. And the question is, in this new era, so how do we keep in touch with healthcare professionals while they're not available? Maybe one single table, that kind of summarize the difficulty is that in pre-COVID time, if you remember, it was 3 months ago, the prospection was done by the sales team. And you would convert the physicians, you would convert the people meeting. So that was the sales team that was in charge of the prospection and of the conversion. In this post-COVID time, the things have changed, and this is the main shift, the prospection should not be done anymore by the sales team. This is a different job. And actually, this is impossible to do the prospection when the physicians are not available. Well, you know that the healthcare market has always been very slow to transform itself. But what is happening in the other markets is that there is a specialized team that is in charge of generating the leads, and the sales team is in charge of converting the leads into like money or selling products. So this is the main shift that we are going to discuss today. Well, I'd like to use this study by McKinsey. Well, of course, it's always nice to have, a McKinsey study in a presentation. But for this one, what's interesting is that McKinsey has asked American doctors, and American doctors only, what were the change and what was the change in the use of digital tools after the crisis. So main thing is that telemedicine for physical health consultation, more than 50% of the American doctors say that they're going to use it more and more after the crisis. Same thing for remote learning for nurses and practical staff. Video conferencing, we're all sick of all the video conferences. Thank you for attending this one, but this is going to be used more and more widely. And also the remote learning for physicians. What physicians learned because of this crisis is that it's not very difficult to use a video conference tool. If you can do an open heart surgery, you can probably use a video conference tool. And you can see here that almost 50% of them mentioned in this study that they are going to use remote learning in the future when it comes to training. How it is happening in the other markets, I'm using the example of Facebook. You've probably seen that Facebook has ended all the big meetings, like plus 50 people meetings until summer 2021. Chanel, the French perfume company, they don't see the return of tourists before summer 2021. Same thing for all the medical conferences. You've seen that they've been postponed and then eventually they are canceled. And when they are going to happen again, well, no one really knows. So you've seen kind of ads at a lot of these conferences. They're trying to go digital. Some of them will manage or not. Nobody knows at the time being. So what we see now is kind of like the fear of other is back. We're all going to ask ourselves, like, do we really want to climb into this plane that is packed with people? Do we really need to go on the plane each time we have a meeting? Are we ready to go back to the stadium with 100,000 people? Are the physicians ready to go back to a medical conference with 20,000 people? So I think this is really the new questions that we are asking to ourselves thanks to this crisis. We can also probably, if you work in a company or in a medical device environment, you've probably seen that all these like grand gathering, grand mass meetings for the sales force, they've all been canceled. I mean, was it reasonable? It's another kind of debate, but this is the end of that, at least for 2020 and 2021. So what are the immediate consequences of the COVID-19 crisis? And these numbers come from the French market, yeah? So they might be different in other countries. But in France, what we see is that there is a drop of 75% of appendicitis operations. That is just April, yeah? There is almost half of the visit to general practitioners. 45, it's not 45 surgeries, cancer, yes, it's 450,000. Yeah, there is a zero that is missing here. Also 60% less visits to the specialist. So here's an example, a quote from a physician we work with at the Institute, at the Curie Institute. He sees 10 women suffering from breast cancer instead of 40 women in general. So as a matter of consequence, yeah, all the healthcare professionals from now on, they're totally overloaded. Now, they're overloaded with patients suffering from chronic disease, from degenerative disease, chronic pain, all the surgeries that they have to reschedule. And the thing that we are seeing also is the post-COVID syndrome. So basically, they have very, very little time left for side activities, such as like clinical research, medical conferences, and also meetings with sales reps and industry executives. And this is why we're all asking like the $1 million question, yeah? How do I keep in mind? How do I keep in touch with healthcare professionals in this new deal? And also, which is very important, yeah? How do I keep in touch with them, staying in the regulatory framework of the pharmaceutical industry or the medical device industry? And I've been operating in this industry for the past 20 years, as I mentioned at the beginning. So we always try to think of the regulatory framework when we do something, and I'll come back to that. So this was kind of a long introduction, but I think it was kind of necessary to explain where we stand now and what is at stake. So on the other hand, there are things that are still existing, yeah, for healthcare professionals, which is the need for training, the need for information, the roundtables, the past education training. They're still necessary. The question is how to respond to these needs is to reinvent. Yeah, how do we do that now that we cannot visit healthcare professionals? In France, this is forbidden to visit healthcare professionals in the hospital until the end of the year 2020. So what are the right questions to ask before starting like a strategy? Well, first of all, first question is, what are my clients' new needs in this new era? Yeah, what are their new constraints? Where are my clients? When I mean where, we used to visit them at their place of work. Now they're not available. So where on the web are my clients? What are the social networks that they use? And when are they available? Because they are not available during the day because they are packed with their patients, with their operations. So when is the good time to address them? And also, which is extremely important, it is what is the most suitable content that is going to raise their level of curiosity? What is it that's going to make them open the email or the message or the post that I'm going to send them? And this is extremely important, yeah, because that will drive everything. So how do I communicate with healthcare professionals? Of course, you can use emails, you can create newsletters, social networks, WhatsApp groups, you can launch webinars, you can launch a YouTube channel, you can have a Facebook Live. But so how do I start? And this is what I'm going to try to address today is practically speaking, yeah, how do we do that? So just some bulk data about healthcare professionals. You know that on average in Europe, an healthcare professional receives 380 emails per day, and 360 of them are not wished by the healthcare professionals. Yeah, this is an important information that you probably know, but on average, people come to a website 7 times before they move on to a purchase decision, whether they purchase a training, whether they register for a training, for instance, or for an event that you will organize. People need to come 7 times to the same website. What's also interesting is the opening rate of a newsletter. You're probably all using a newsletter. The opening rate's really poor, is really bad. So this is something that you really need to think about the content. And if the content's interesting, the opening rate will be higher, of course. So we're all back to the content. Another example of something I really don't like is all the apps that have been launched by all the pharmaceutical industry and all the product managers. There are, for instance, 4,700 diabetes applications that are available on the Apple Store. And guess how many are used for real? It's like very close to 0. Yeah, just you can count them on your fingers. And one thing that is important as well is the price of a LinkedIn profile, and you'll understand why I mentioned that just a little later. So how to manage the remote relationship? Yeah, this is what we're talking about. We're having a remote, like a distance relationship with healthcare physicians. So of course, there are a lot of tools that are here to help to train and inform. Yeah, there is all the e-learning modules that you can create. There are like video learning that is possible, video conferences like today, what we're doing today. Of course, there is the social networks, yeah, the global social networks, but also the specialized social networks. And of course, how to manage this remote relationship, you need to find the right profiles. Yeah, these profiles are people with a different background, and you cannot use the same people to to generate some leads as you would do in the past. And of course, and this is the most important, is you should have a global strategy on like short-term, mid-term, and long-term that is kind of adapted to the new behaviors of the healthcare professionals. So these are the current questions that we get from our questions at my company, at ᴘᴏsᴛ-ᴄᴏ. We very often get a question about the roundtables. Is it possible to do a roundtable on Zoom or WebEx? We have the questions about, is it possible to train remotely on a new medical device? Is it possible for an expert to present a clinical study on a webinar? Is that possible to turn an on-site event into an online event? And for instance, also we have questions about like interactive clinical cases to our clients. So good answer, like good news. The answer is yes, this is possible. There are plenty of tools and there are plenty of people that are able to turn our on-site events into online events. And what are the tools available for that? So first of all, you have the social networks, and the social networks, the first question to ask to yourself is, where are the DOLs? So the DOLs, DOL stands for digital opinion leaders. You know what is a KOL, key opinion leaders. Here we're talking now about the digital opinion leaders. Some of our calls are not digital opinion leaders, and so there are a few tools to help them to transform, to move into DOLs. So the social networks, you all know them, but what's important to know is that you're not going to use the same social network depending on the target that you want to address. If you want, for instance, to address the nurses, the dentists, or the plastic surgeons, Facebook is perfect for that. Yeah, they're all on Facebook. They all have an account, and the audience is easy to find. there's LinkedIn. LinkedIn is very professional, is made for professional. There are a lot of people on LinkedIn, yeah, almost 700 million people on LinkedIn, and people are clearly identified by their profession. You can also use Twitter. If you work with journalists, if you work with urologists are on Twitter. Don't ask me why. It's bizarre, but this is the way it is. If you work with medical societies, they like Twitter as well. WhatsApp is a brand new social network. It's very powerful because people they do read the messages that they receive, and also Instagram, that is part of Facebook, yeah, for specific audiences and events. So I was talking about a DOL, digital opinion leader. Yeah, there are plenty of tips for spotting a digital opinion leaders. And what we do on a regular basis at ᴑɪᴅᴜᴜ is we help transform the key opinion leaders into digital opinion leaders to have a share of voice on the market. Let me try to explain in a business case, yeah, how we transform a key opinion leader into a digital opinion leader. I'll use the example of Professor Alain Cribier. Alain Cribier is extremely famous in France and all over the place in the world because he invented a technique. He's an interventional cardiologist, and he invented a technique called TAVI for the replacement of the aortic valve. He was on the shortlist of the Nobel Prize a few years ago. And we worked with Professor Cribier at ᴑɪᴜᴜᴜ, and when we started to work with him, that was 2 years ago in 2018, he had only a few contacts on his LinkedIn account, as you can see, like 230 accounts. And today, 2 years later, yeah, he has 27,000 contacts on his LinkedIn account. And all of them are interventional cardiologists that are spread all around the world. And so this is thanks to the tools that we are using, that he has grown his network up to 27,000 contacts. And then all of a sudden, he used to be a KOL invited everywhere in the world. Now is a DOL, which is giving him a wider spread all over the world, and like an immediate spread of anything that he is going to do on his LinkedIn account. Yeah, this is a screenshot of his LinkedIn account where you can see it's like almost 27,000. Here is an example of what we're doing with him. With Alain Cribier, we organized on-site events. So Alain Cribier used to invite to his university hospital in Rouen in France, around 30 patients every second month. And now when he posts the event, as you can see, this is the title of the event that we have posted on his behalf on LinkedIn. Yeah, immediately you find a lot of people that are interested, because this is addressing the 27,000 people, plus all the people that are going to share the news with their own network. So all of a sudden, yeah, because he has this enormous network, thanks to the tools that we have developed and that we have installed on his account, yeah, he has this share of voice on the market, and he can do that from his own table, thanks to our help. So that was example number one. I'd like to walk you through a second business case with another French doctor. Yeah, well, sorry, yeah, we operate in France, so a lot of the cases are in France. This is a case of Dr. Adrien Rosé. Adrien Rosé is an is an anesthesiologist working in Bordeaux. And during the peak of the COVID crisis, we've been asked by a medical device manufacturer to organize a webinar. They really wanted to go fast. So we created the webinar on our platform, like the ᴑɪᴜᴜᴜ platform. And it was published on April 9th. And then just a few days later, yeah, a week later, we had 380 people who registered for the webinar. And we even had to add another date because there were so much of the people asking to register for this webinar. It was about the ventilation of COVID plus patients, so it was a very hot topic. But just in a few days, we were able to reach almost, well, not to reach around 10,000 anesthesiologists, and 600 of them registered for the event. So how did we do that? Yeah, this is, I think, what's more interesting, the how than the result. So everything started from a post on the LinkedIn account of Dr. Rosé. What we've done is that, of course, we shared the post with the InVivox team and all the tools that we have, but also the post was reshared by the 50 sales reps of the medical device manufacturer that we were working with, and then also shared by the French Medical Society of Anesthesia. So altogether, that created what you really want to do on the social network, which is called the snowball effect. Yeah, like one that is reacting on the other. And at the end of the day, a lot of the people just received the information. So everything started from a post, but not only, because you need to post, and after that, you need to use the right tools to make sure that things like at the end of the day, people are going to register. So we're using retargeting tools to make sure that the people who came once on our website, who discovered the opportunity to register for the webinar, that we would retarget them if they haven't registered. So we're using different tools that are available on the market. We've created landing pages as well to make sure that there are several entrances possible. This is a very classical. We're working on the user experience. I like to use this slide for the user experience. You know, like there is the design, and they say like user experience is king today. So our platform, our website is made to make the user experience as smooth as possible. And we're also using the SEA, so the search engine optimization, to make sure that the people who are looking for training will find the training on Google, Yandex, or Bing. We're using different scoring techniques on our website. And of course, we have the people internally that are able to assist, to support, and organize the technical part of the training. So when you put all that together, you manage to gather around 600 people. And this is a screenshot of the training with Dr. Rosé. He was able to share a movie during the training. He was able to launch a poll to make sure that the people are together with him and understand well what is happening. And at the end, so well, he also had his profile on our website with all the different opinions from the previous webinars. This is very important on the internet, you know, today. We sent, of course, all the analysis of the results, and this is super important. When you develop a strategy, a digital strategy, you want to make sure that you're tracking, you're doing like the right tracking of all the actions that you undertake. And this is what I love about the digital approach, is that you can measure everything that you do. When you launch like a LinkedIn campaign, you will know exactly how many people you have reached, how many people have opened the message, have seen the movie, have clicked on one button. And the more you do it, and the more you will refine what you're doing, and you will get better and better on what you're doing. So what's interesting also is that for what were the benefits for the medical device manufacturer, is that there was a better like know-how of the technique, like the ventilation technique, using a key opinion leader who became a digital opinion leader. The information also was disseminated to a huge number of people, which would be impossible if you don't have a digital approach, and in a very short time. It was extremely well perceived as well, because the medical device manufacturer was organizing but not pushing its products. And as I mentioned previously, when you do something on the digital, you want to make sure that you have a proper management of your own data. And at the end of the day, what we sent to the medical device manufacturer is the list of the 600 people who registered for the webinar. So we were talking, you know, if you remember my very first slide about the lead generation. So everything that we did here was to help create, like to generate some new leads. And they were extremely happy to have 600 new leads with the name, the surnames, the emails, the place of work of the people that they could spread to the different sales force. And now the sales force, they know when they're going to go to a doctor, when they're going to call a doctor to organize a meeting, they know that this doctor has attended this webinar, that he was interested, and that was all done within the regulatory framework in France. So there were plenty of benefits. I'd like to move to a third business case, which is an interesting one as well. We've been asked by a medical device manufacturer, another one specialized in cardiology, how to reach cardiologists because they were launching a new product and they wanted to make sure that they would spread the noise as fast as possible to some people that they don't visit anymore. So what we have developed is like a very strategic approach. We've worked with the medical device manufacturer. We've identified 10 experts that had the potential to become digital opinion leaders. Then we've asked every single expert to bring a clinical case that he has on his computer. Third point is we help to boost the expert's account on LinkedIn. As you can see, we love LinkedIn. Fourth point is that we transformed the clinical case into a very interactive clinical case. You know, the clinical cases of the physicians, they are like PowerPoints, and we have the tools to transform a PowerPoint into something with a lot of questions, with interactivity, etc. And then what we've done is that we've used the accounts of the expert to spread the clinical cases to all their networks of cardiologists. So they've done that once a month, and we tracked all the results. And at the end of the day, it was the right material, it was the right content, because the clinical cases were very smartly chosen by the digital opinion leaders. They were sent to the people, they found some interest to do a clinical case. It was short enough, you know, not to take too much time of the people. And then eventually it really raised interest. So that was the third clinical case. And I'm almost moving to the conclusion of this talk. So what are the key lessons that I'd like to pass on today? First one, yeah, is what are the benefits of a digital approach? First of all, and for me, this is extremely important, yeah, is to precisely target your audience. You want to make sure that when a sales rep goes somewhere, is going to spend 2 hours in his car to go somewhere to visit a physician, you want to make sure that he's properly using his time. Second thing is that like the digital approach is a way to interest your customers with the right content, that you send them at the right time where their mind is open to take some content, not during the day where they are packed and overloaded with their patients, but at the beginning of the day or at the end of the day. But just you need to understand when is the right moment. And of course, using the right network. Yeah, you want to make sure that some specialists I mentioned, like the urologists, they are on Twitter. So if you want to launch a product to an audience of urologists, you want to use Twitter, for instance. Yeah. What's interesting, as I mentioned, is that you'll be able to analyze your return on investments on all the actions that you will undertake, and that's paramount to me. And then you're turning your database, yeah, that is made offline into a community that is talking to each other. So it's what we call the peer-to-peer communication, yeah? And then the main benefits is that you'll be improving the sales cycle with an extended reach of your messages. You'll be reaching some people that you don't talk to. you'll be tracking all the actions that you do, yeah, and you will have better one-on-one meetings. So obviously that brings like a better efficiency and cost effectiveness on all your actions. And of course, the impact of the appointment, like the one-on-one appointments that you will generate, they will be done with the right physician that has demonstrated an interest for your products. So by way of conclusion, I think the most important today is to help your key opinion leaders to transform into digital opinion leaders in order to generate like a peer-to-peer communication. And if you remember some of the business cases that I showed you, we were very successful because that was not the company that was communicated to the physicians. That was like one physician that was communicating to like a global network of physicians. And this is more and more efficient. It's more and more impactful. So last but not least, yeah, this new post-COVID era has already begun. And I'm sure we all agree on that. The second point is that challenge for all of us is to adapt our strategy. Well, you know the history, I'm sure you've read Darwin, and you know that the people who did not adapt disappeared from the surface of the planet. My point is that the one-on-one relationship, the meetings with the physicians, they're not dead, quite the contrary, yeah? The digital approach will allow us to take over, will make this meeting more targeted with the right customers that have demonstrated the interest to learn more about a medical device, a product, a technical a surgery, etc. And so I'm going to finish on that and launch the debate and try to answer your questions about like, so on your side, what have you put in place in your team, in your business unit, in your company, to anticipate the advent of this new era. So thank you very much for the time that you have dedicated to this webinar. You have the possibility to ask questions on the icon on the screen. Yeah, you just need to click on the icon. I can see that there is a first question that I'm trying to pull. So the first, I'm taking the first question, which is Invivox able to leverage its platform for patients' recruitment strategies? If yes, do you have a case study? So thank you very much. It is indeed what we're trying to do. And one point that Invivox is fully dedicated to healthcare professionals. Yeah, so we don't address the patients at all. And for plenty of different reasons, but one of them is the regulatory reason. We don't work with patients at all. So my first answer is no, we don't work with patients. Thank you, Caroline, for your comments. The question from Caroline is, are there still some operations, some surgical operations happening? So yes, there are like a lot of operations, but as you know, in France, it is officially forbidden to visit the hospitals. So this is the reason why we need to find new possibilities to enter or to keep in contact, to keep in touch with surgeons that are operating. There was a third question from Caroline. I have another question from an anonymous. Hi, Julian. What do you think is the best way to take contact with physicians that are new to us and who do not know very well the sales force? Yes, indeed, that's a great question. And I think that the interest of a digital approach is that you're going to spread your message to a lot of people that you don't know. And this is why you want to track people. You want to make sure that when you organize something, you're going to get the data of the people. Let me take the example of this webinar that I have organized. I could have broadcasted this webinar on Facebook. Yeah, probably I would have got a better spread, but people do not register on Facebook. All of you who have registered to this webinar, there's some of you that I might know, but most of you I don't know. And if you probably realized that we've asked you to give your email address and also to give your cell phone number. You might receive in the upcoming days a communication from our side. Probably it's going to be on WhatsApp, on your cell phone, inviting you to join me for a one-on-one conversation to continue like the conversation, but privately, to enter into details what you guys are doing in your organization, and if there is something that we could do together. So to answer your question, yeah, when you reach people that you don't know, you want to make sure that you will get the data of these people so that you can launch new actions after that. Yeah. So for you, as I just mentioned, a lot of you I don't know, you will receive the replay of this talk, and then a few days later you will probably receive a WhatsApp message from me or another type of information. Another question is, how do we guarantee the quality of the promoted webinars? Very good questions. We don't guarantee the quality. We work with all our partners. We trust them, and we believe that if the topic is good, if the speaker is good, there will be a lot of people that will register. And on the contrary, if the topic is not hot, or if the topic is too general, or if the speaker is not well known, then it won't work. So we don't guarantee the quality. Yeah, we leave that to all our partners. I have another question from James. Can you reflect on us and our experience today as prospects of InVivox? What strategy did you use? Especially, how did you target us? Okay, thank you. Yeah, I love this question. So first of all, the way I targeted you is on LinkedIn. On my side, I have a LinkedIn account with, I don't know, 25 or 26,000 people, most of them working in the pharmaceutical or medical device industry. This is a network that I've built using automation tools, robots, and I'm sending invites every day. So a lot of you have been invited through LinkedIn. We created an event on LinkedIn, and you registered for the event. And then once you've registered, I think I had almost 500 people who registered for the event. It doesn't mean that they have registered to this webinar, but they showed a first interest. And then we retargeted all of you to invite you to register. Yeah. So we've used only one network because the aim today was to talk to executives from medical device industry, pharmaceutical industry, and this is why LinkedIn was the most appropriate network to reach you. I have a question from David. Thank you, David, for your comments. The question is Zoom or whatever platform ready for live videos or presenting using video instead of to PowerPoint? Yes, of course. Yes, David. On Zoom, you can share whatever you want. So what we're doing for a client of us is we're helping the client to share surgical movies with surgeons. This is because you cannot talk to the surgeon, you cannot be in the operational theater, physically speaking. So what we're doing is that we've selected some very good movies, complex cases, and then we've invited people to join on Zoom. And instead of showing a PowerPoint, the expert is commenting the movies. What's great with that is that you don't lose time traveling to the place of the physician. you don't lose time waiting for the patient to be ready. You go directly to the critical part of the surgery, and the expert has the possibility to come back, to repeat what's happening, to answer all the questions. So yes, yes, David, great question indeed. You can use the Zoom for sharing any kind of content. I have a question from Vincenzo. Vincenzo, questions about congresses. Do we have any case on this topic we managed in this emergency? So I understand this question is about transforming an on-site conference into an online conference. So we don't do that. There are companies that are specialized in that. But for us, this is just too big. We really try to concentrate on small events like bringing very high quality information or training. But there are companies that help doing that. I have another question from Adam. Thank you guys for all the questions. That's making me very happy, proving that you were interested. So what is the best way, Adam, you're asking what is the best way to analyze the impact, good or bad, of our webinars? Okay, well, two things. You know, I told you I'm a big fan of tracking everything. So the first KPI that you could use is the number of people that you have reached on your campaigns. Yeah? Your campaigns can be like a Facebook campaign if you're addressing, I don't know, plastic surgeons, for instance, or nurses. And then also the conversion rate, yeah? How many people you've reached and how many of them have registered. Also, what's possible to do, and I didn't do that today, but I usually do it, it's possible during a webinar, it's possible to launch some questions at some point of the webinar. So I could have stopped at the middle of the webinar and ask you like, well, you guys, are you still with me today? Or at the end of the webinar, I could ask you now, like, did you like this webinar? Is it fulfilling your expectations? So this is a nice way, you know, to see the level of interaction of the people. And also another KPI is the number of people who registered and the number of people who officially participated in a webinar, because most of these webinars are for free. So there's kind of a discrepancy between the people who register and participate. I hope my answer was clear enough. I'll move to another question from Stefan. Thank you, Stefan, for your comment. So the question is about how do we turn clinical cases interactive when you say transform them into interactive model? Okay, well, so you probably know, you've probably seen a lot of clinical cases. Yeah, usually they are done on PowerPoint. Some of them are interesting, some of them are not, but it's still the same format. We have tools, yeah, that enable to transform like a PowerPoint that is very static into a very dynamic new module. So it means that you can create some interactivity, you can create questions. When the question is bad, there can be like a pop-up window opening with an explanation from the expert. The explanation can be a text, it can be a video, it can be a voice. And then you can bring the people, you can show a movie, you can ask the people to select an area in the movie, or to mention what they see. So it's very interactive, and it has to be short, you know, because people, like, the level of concentration is not great at the time being. So we have people that are specialized into that in the company, and we take a PowerPoint and then we transform it into an interactive clinical case. Okay, Vincenzo asked me to be more specific with Congress. Yes, okay, so I understand the questions about satellite symposia. Yeah, well, it's very easy to organize, and we have clients that are doing that today. When they organize like an online satellite symposia. So instead of going into a room like physically, yeah, you go on a big webinar room. So yeah, this is very easy to organize, and I'm happy, to organize one-on-one sessions and to take more time, like directly on Zoom, to take your questions and to see what's possible to do. I have questions from Karine as well, asking me what I think about conference versus digital symposia. How can we keep the attention of the audience? So I think it's a good question, yeah, Karine, because you know that usually after 45 minutes, the attention of the people do drop. And so you need to create something that will kind of awake the audience at some part of the presentation. And I'm sorry I didn't do that today. I usually do it during my webinars. I asked questions to the people, and the tools that we use, like Zoom, but most of the other tools, they propose the same. Yeah, you can launch a poll. So it will mean that you stop your presentation and you're going to ask the people that are behind the screen to express themselves. And the good thing is that it's interactive, and at the same time, you can share the information that you have gathered. So imagine that you have 500 physicians on the webinar. You can ask them, for instance, if they are back to normal with their business life, and then immediately you will see who is 80%, who is 100%, 120%. You can really create the questions that you want, and then gain, raise the attention of the people, and also gain some information for yourself. You may want to combine a PowerPoint, but also with a movie. You may invite several people on the talk. It could be like several speakers. There can be someone that is going to moderate the talk, like you could have a journalist that is going to moderate the talk. So these tools today, they're available. And like we've been organizing more than 250 webinars during the past 2 months. So we're very used to working with them. Still questions from James about the cost of LinkedIn. Yeah, the $850 cost on a LinkedIn profile. Yeah, I can expand on that, James. When Microsoft acquired LinkedIn, they acquire. If you think about what was the cost for each LinkedIn profile, the cost was $850. It gives you an idea on how important a profile on LinkedIn is, and why this network is something that is extremely important today to launch very targeted campaign. And this is why we're using LinkedIn a lot to grow the account of our experts, but also to spread the messages. Let me try to take two last questions. This is a question from Sergey. Привет, Sergey. I used to work with Sergey in the past in Siberia. So, привет, Sergey. Thank you for your comment. So I'm reading your comment. I also think that digital instruments are good enough for prospections and generation of leads. The idea of digital opinion leader is a bit new for Russia, but quite interesting. Yes, well, actually, I believe this is a little new for everyone in the healthcare environment. But the reaction of the key opinion leaders is extremely positive when you explain them that you're going to expand their network, and then that thanks to that, they'll be able, for example, when they want to share the results of a new clinical study, but instead of sharing that with 230 people, they will share that with thousands of people. So this is really making a big difference, and the key opinion leaders, they're very sensitive to this approach. So that was the last question. from Sergey. I don't know if you want to ask a last one that I'm very happy to take. Well, and I think most of you know me through LinkedIn. You have my email. You have my. You can contact me on LinkedIn if you want to organize like a chat with me, like a one-on-one chat. I'm very happy to take the time and discuss what you have done on your side, yeah, to address the physicians while they are not very much available, or what we could propose as a company specialized in this field to help you. So guys, it is 5 to 5. Well, we still have 5 minutes, but I think it's been a great session. Thanks to all of you for all the questions and for the time that you have dedicated. And one more time, yeah, please do not hesitate. That was the goal of this webinar, to create some interest and then eventually to have a one-on-one conversation that I'm happy to plan and schedule in the upcoming days or weeks. Thank you to all of you. I wish you an excellent day wherever you are in the world. Well, I hope that we can see each other like face to face and share a beer or a glass of wine sooner than later. Thank you very much. Bye-bye.